So Burley, we just did her heartworm test. We're going to do a physical exam on her today. As you can see, she's a really bright and alert. She's a really happy patient. When you see her walking around, if one will just kind of take her around, she doesn't have any issues with her gait. She wants to take him for a little spin. She's really actually got a good body weight. I would say probably a 2 out of 5. She's not too thin, doesn't have too much fat on her body. You can still palpate those ribs when you kind of feel along her abdomen. She's really happy and doing pretty well. So we'll get her up on the table here. We'll get her weight. Okay, I know, crazy. Okay, so we'll get her on the scale. So we've got her at about 15 pounds. We'll take her off the scale. We'll just note that down. Now, as we come to take a look at her, one of the first things we want to do, even just with a standard TPR of our patients in the room, is just take a look at their gum color. So she's really nice and pink. We're just checking her CRT and at about a 2, which is completely normal for a healthy dog like her. As you can see, she's panting, so to take her respiration, what we normally would do is take a look at how her chest is rising and falling. We would kind of time that in 15 seconds, count that, and then multiply it by 4 to see how many times she's actually taking a breath in a minute. But because she's panting, it's really hard to assess that accurately, so we'll just consider her respiration as panting. One of the things that we will do is take our stethoscope and listen to her heart. So we'll listen on both sides of her heart. We'll look at, we'll listen to all of the different areas of her heart to just make sure everything sounds right, make sure she doesn't have a murmur, and then we'll check it against her pulse to make sure that her heartbeat is matching the pulse that we're feeling. So we'll do that now. So a nice strong heartbeat, matches her femoral pulse. I didn't hear any weird murmurs or anything. She's pretty young and healthy, so she doesn't seem to have any issues. So what we'll do now is just take it from front to back, basically. We're going to look at her eyes, just make sure she doesn't have any drainage. She does have some issues with tear production, so we put some eye drops in her eyes a little bit earlier. But we'll just make sure that there's no drainage, no major redness of her cornea or her sclera. Make sure there's no scratches or abrasions or ulcers that we can see. We're also going to look at her nares, make sure they're not stenotic nares, there's no major drainage. We'll just take a look at her teeth, inside her mouth, both her hard and soft palate. If we can get a good look under her tongue just to make sure there's nothing hiding under there. She's really, really young, so she's got some great pearly white teeth and very playful and friendly, as you can see. We'll take a look at her ears, make sure there's no major abnormal redness of her pinna. Obviously, we can't look down without our otoscope, but we'll just take a look and make sure that everything looks normal on both sides, that there's nothing abnormal that we can note down for her. As we move down, we'll go ahead and try to palpate her lymph nodes along her neck here, her prescapular lymph nodes as well. We'll go ahead and just kind of assess her range of motion and make sure that she's not having any neck issues, so we'll just kind of move her head up and down as much as we can, as much as she'll allow. We'll just palpate her trachea and make sure that she's not giving us any weird abnormal coughs when we do that. And then we'll kind of move down to her limbs. We'll just make sure that she's got good range of motion, that we can kind of move and she's not showing any signs of pain. Look at her nails. She could use a nail trim. Make sure there's nothing abnormal with her paw pads. And again, just doing that on both sides, making sure she's got good range of motion. No abnormalities with her paw. And then Juan's just going to spin her around for me. What I'll do is just kind of look at her coat. She's got a nice, really soft coat. Again, young and healthy, doesn't have any issues. We'll just kind of look and make sure there's no parasites like fleas or ticks, as much as we can, just making sure there's nothing abnormal going on. We'll palpate along her spine, make sure she's not painful in any way, and just make sure she's not giving us any issues or senses of discomfort when we do that. we'll start to kind of palpate her belly and make sure she's not showing any signs of pain when we do that. You can feel her bladder. She's got a full bladder in there. We're also just making sure that there's no enlarged or abnormally sized organs in there. A lot of these organs, you know, the stomach, if it's not full, you won't really be able to feel it. Liver and kidneys, unless it's enlarged and there's something going on, you can't really feel them. You can usually feel the bladder and the intestines as little loops in there, but otherwise she's doing pretty good. We'll kind of move along, and same with the front limbs. We'll check her range of motion, make sure she's got good range of motion in both of her limbs. Palpate for those popliteal lymph nodes. Again, check the paw pads and nails on the back limbs here. Everything's pretty normal. And we'll check the anal area, make sure everything looks normal, no super full anal glands. And then usually just check the genitalia, make sure there's no irritation, redness, swelling, anything like that. So in a abnormal dog, we'd write down anything that we found that was abnormal. With her, she's young, healthy. She doesn't seem to be in any pain or discomfort. So we'll just take her heart rate. I listened, but we'll go ahead and time her heart rate by just feeling that femoral pulse and counting how many beats we feel in 15 seconds, multiplying it by 4. So we got 32, so 32 times 4 would be 128. So we'll note that down. She was panting. CR2 was 2 in pink. And last but not least, we'll take her temperature. So we've just got our thermometer with a little bit of lubrication. Juan's just going to go ahead and hold her up here. Get her temp real quick. Otherwise, she seems to be in pretty good shape, eating, drinking well, with just some minor ear and eye issues going on that we're just treating. Otherwise, she's got a nice strong heart, nice strong pulses, normal temperature, and she's a pretty happy and healthy dog. So 102, which is completely normal, and we'll just take all of this information and put it down in her chart. Otherwise, she is good to go.